It's been more than 3 years since San Diego County officials declared a state of emergency for COVID-19. It was announced in mid-February of 2020 out of an abundance of caution.
Really a proactive step of prevention and protection.
Soon after, the governor's stay-at-home order was issued along with California's state of emergency. That resulted in 74 executive orders and nearly 600 additional provisions that state officials say helped save thousands of lives.
There are a lot of regulations that were suspended as a result of the pandemic to allow us to move faster.
Scripps Health CEO Chris Van Gorder says hospitals have been able to keep up with demand thanks to those orders. They allowed for higher patient-to-staff ratios and the ability to quickly add extra bed space.
We could have had a real, healthcare catastrophe had the, government agencies not worked hand in hand with the healthcare providers.
Last week on Thursday, Scripps had 80 COVID patients admitted across the county. That's far from daily counts of more than 300 during surges. Van Gorder says it's time to end the state and local emergencies.
That fear and, verge of panic that we saw 3 years ago is really gone. Our physicians, our nurses know how to take care of these patients.
California's Department of Public Health says of the nearly 600 provisions issued, just 27 are in place until March. Masking is still required in healthcare settings and long-term care facilities. State health officials say those orders are not tied to the pandemic emergency ending, and Van Gorder is waiting for more details.
There's probably a lot of people, including hospital employees, that are curious about that, and we'll wait and see what the state may decide to waive that when they waive, the healthcare emergency, or they may extend it.
The state and county have been winding down their pandemic responses. Long gone are the mass drive-up vaccination and testing sites. San Diego County Public Health Officer Dr. Wilma Wooten has been leading the region's pandemic response.
We still have to do the same things that we've been doing for the last 3 years, now at a smaller scale, but who knows how the situation could change where we need to ramp up again.
Wooten says plans are in place should they need to scale up again, but she says the pandemic is manageable.
The cases are not as low as I would like to see them. They are between mid to 200s. So that is evidence that the virus is still circulating in the community, and we can't rest on our laurels and, oh, we're through this. The pandemic is not over.
The county is continuing to monitor COVID through San Diegans' wastewater, and recently the amount of virus has been going up.
Things are overall pretty darn good in San Diego County. The only issue that doesn't go in the right direction is the wastewater surveillance shows some uptick, but hospitalizations are way down.
Dr. Eric Topol from the Scripps Research Translational Institute isn't forecasting any substantive changes with the state and local pandemic emergencies going away. The virus has been producing new variants, but while things are relatively quiet, he would like to see investments in better vaccines.
We're not prepared. And we could be working on this, but we're not getting serious enough.
Topol and other health officials say COVID certainly isn't going away and could look similar to the flu, with vaccinations recommended every year. Topol says if we continue to have minor COVID waves, the virus could be considered endemic, but that's too early to say for sure.
It all depends on whether this virus can find a new path to get to hosts and hurt us. Whether it's run its course. If it has run its course, as in all these recent variants that we've been through, then it will be in an endemic state.
The federal COVID emergency is set to end in early May. For all Californians, vaccines, testing, and treatments will still be available with no out-of-pocket costs for an additional 6 months. Matt Hoffman, KPBS News.